What is restless leg syndrome? What are common signs and symptoms? And what causes it? And how do you prevent it? In this video, we are going to answer your restless questions about restless leg syndrome, and we will present our top 10 recommendations to prevent restless leg syndrome without medications. Hi, this is Mark William, Board Certified Geriatric Pharmacist. Welcome to Prime Health, where we help every person achieve better health by providing prevention and wellness advice. It is estimated that 5% of the general population and as many as 10% of those over the age of 65 have restless leg syndrome. What is restless leg syndrome? Restless leg syndrome is the irresistible urge to move, uncomfortable sensations in legs, less commonly arms, very few chest or head, described as aching, throbbing, pulling, itching, crawling or creeping. Sensations are relieved by moving, constantly moving legs, pacing, tossing and turning at night. It is usually worse in the evening, but it can happen in the morning during prolonged sitting, more difficult falling asleep, staying asleep or returning to sleep. Signs and symptoms. We choose the mnemonic urge to move legs, rest-induced, which is worsens during rest, gets better with movement, and it happens in the evening and or at night. What causes restless leg syndrome? Family history contributes to 40% of cases. Evidence indicates that low levels of iron in the brain may also be responsible for restless leg syndrome. Dopamine is needed to produce smooth and purposeful muscle activity and movement. Disruption of these pathways frequently results in involuntary movement. How is restless leg syndrome diagnosed? Since there is no specific test for restless leg syndrome, the condition is diagnosed by a doctor's evaluation, a neurological and physical exam, plus information from the person's medical and family history and list of his current medications may be helpful. Laboratory tests may rule out other conditions, such as kidney failure or iron deficiency anemia. While there are prescription medications that can alleviate restless leg syndrome and improve sleep, here are our top 10 drug-free recommendations that can alleviate the symptoms and manage restless leg syndrome. So let's jump into it. Number 1. Sleep hygiene is a good place to start. Limit your exposure to bright lights for about an hour before bed. This includes TV, tablet, or phone. Number 2. If you experience symptoms after you get into bed, then get up. You don't want to have a negative feeling associated with going to bed. It is better to get up and move around or do something distracting before you try to go to sleep again. Crossword puzzles and reading are effective way to distract without interfering with your ability to sleep. Number 3. Chamomile tea is a wonderful option. It is very relaxing and helps to induce sleep. It's worth a try. There is lots of other caffeine-free tea varieties on the market. Number 4. Warm bath or shower can help relax the muscles in the legs and other affected areas. Number 5. Massage is beneficial, especially for those who are unable to get up and move around. Products containing menthol, capsaicin, and wintergreen oil can increase the blood flow and help distract from restless leg syndrome movements and pain. Number 6. A hot water bottle can provide relief for some people. This is a good approach for elderly individuals. Heating pads should not be used in conjunction with muscle wraps and liniments though, so be sure to read the directions on the product. Number 7. While warmth may help some individuals, cold may be more useful for others. Applying an ice pack or taking a cold shower can help minimize restless leg syndrome symptoms. Number 8. For those who are able, low-impact exercise is a good option for treating restless leg syndrome and improving overall health. Some time spent on stationary bicycle or in swimming pool can help tire out their legs. Just be aware that working out too late can keep you up at night. Number 9. Caffeine, nicotine, alcohol, and some prescription and over-the-counter drugs, for example Benadryl, melatonin, and some anti-nausea medications are most likely to worsen restless leg syndrome symptoms. Number 10. Stick to a set bedtime routine. reduce stress and anxiety through healthy outlets like gardening, exercise, and breathing techniques. You will find links to breathing techniques and all reference links on the description box below. We hope we answered all your restless questions about restless leg syndrome. If you like our video, make sure to hit the subscribe button. And please share in the comments below any health topics you would like to hear about from a trusted health person. Hope to see you soon. What is restless leg syndrome? Chamomile tea is a wonderful option. We hope we answered some of your restless questions. Product containing menthol and massage is beneficial. It is better to get up.